Hello, my name is Cassandra Moore, and I'm here to present to you my project on teaching with technology, a web-based case scenario on interprofessional collaboration and communication. I'm finishing my master's in education through Excelsior College, and I have over 13 years of experience in the healthcare industry. I have 10 working as a registered nurse. I started in acute rehabilitation nursing as a new graduate. From there, I worked in med-surg nursing and now at a level 1 trauma center in the intensive care setting as a float nurse. The purpose of my capstone project is to bridge the gaps of nursing education noted in the Institute of Medicine's report, The Future of Nursing, Focus on Education. These gaps encompass higher-level concepts such as interprofessional collaboration, communication, and leadership that take on a patient-centered care approach at the associate's degree nursing level. The project takes on these core higher-level concepts and places the students within the adult learning theory, embracing modern technologically savvy templates in a student-centered learning fashion through the completion of a web-based unfolding case scenario. The ADN nursing program that I am working with is organized in a traditional manner. Traditional classrooms often do not promote critical thought or active student participation. Generally, there is tight control over the classroom, constraints of too little time, and oversaturation of material with preference to examinations and scholarly writing. There is more focus on the processes of teaching rather than on the processes of learning. Learning is commonly defined as a process of behavior change from the learner. Shouldn't the learner then have more control over the learning environment? The final course of this program of the nursing program is Nursing 202, Leadership and Professional Development. This is the first course in the program to go hybrid this coming fall semester. Students will work through a web-based course caring for complex trauma patients. The web course will ask them to make decisions regarding the physiological and psychosocial needs of the patient and their situation. The students will also listen, interpret, and communicate patient needs and recommendations with other health disciplines, perspectives, and act as a team leader in the patient's care. The webcast offers some videos regarding background information on interprofessional competencies and some links to literature regarding collaboration and communication throughout the learning activity for purposes of the webcast and for future practice. Next, I would like to take you through a few screenshots in the way that the case study or the learning activity was designed and developed. We started with first presenting the patient's situation. Then on the bottom of the screen here, the RN appeared in form of an avatar speaking of how she is going to communicate the patient's needs and prepare for the patient's arrival to her progressive care unit. Next, more patient data was then revealed, and the admitting team, trauma, with Dr. Gates, came to the bedside and verbalized his treatment plan of care, and admitting orders for the patient's situation. The RN collaborated regarding needs the patients verbalized to her. More data was revealed 6 hours later, along with consults from other health disciplines such as ortho with Dr. Cooper and neurology with Dr. Lee. The case study evolved over 3 days where the students participated in discussion questions regarding the patient's case. The web case study can be found on Zoonal.com, and the link is provided here for you. The key stakeholders in the project include myself, the project developer. I worked off of well-grounded self-efficacy, which is the source of strong belief that a situation is changeable and malleable. Any efforts for change is bound to pose struggles, challenges, and benefits. We saw that this ADN program had a need for change, and we implemented a plan to make that change come alive. Changes in both students and faculty workflow would be expected, and nurses functioning on all levels within better stages, including expert nurses, shall foresee some adjustments with any kind of change. The nursing faculty implemented in this process of change as well, in mentoring and guiding, along with providing feedback regarding the structure of the project um, to ensure that it fit well within the current program structure. Other stakeholders include accrediting bodies that grounded the efforts for the project. The World Health Institute states that interprofessional collaboration should be taught to all the professions. According to the WHO, the need for the interprofessional collaboration in education is essential for positive patient outcomes. Our communities are facing relentless shortage of healthcare workers with fragmented healthcare systems. With this increasing complexity in presenting health issues and illnesses is calling for collaborative and holistic care in order to achieve the best possible health outcomes. The other stakeholders include the students themselves who participated and worked through the learning activity as a part of their first grade. There's supporting evidence in hybrid learning formats, including the fact that hybrid learning formats have both humanistic and technology-based benefits. Humanistic benefits include motivation, personalization of face-to-face contact, immediate feedback from face-to-face contact, fluency in listening to each other, relevance of the topic areas and within the discipline being discussed. Technology benefits are what grounds this project and include mobility, structure of the teaching, tracking of the teaching and content is more easily done through the web, self-study and self-paced through the module, reduced costs, and global reach, meaning that students who live in remote demographic areas will not have difficulty accessing the learning activities. The theory that the project was based on was the adult learning theory, which moves away from traditional instruction and questions the ethical stance of teacher-centered approaches. Instead, we need to empower students to think for themselves and to apply course concepts to real-life situations such as our trauma patient. The adult learning theory operates under the premise in 6 assumptions, including adults have more real lived experiences to relate to. Adult learners are more focused on the process and relevance of learning than the actual content. Adult learners value self-concept and autonomy. Adult learners thrive off of self-direction and are proactive. Adult learners are ready to learn. Adult learners also need to know the reason for learning before they can undertake the task of learning. It is noted that nursing students have had a dramatic increase in adult enrollment, along with enrollment from students that have prior professions and/or prior degrees, encompassing the fact that the adult learning theory is very important to implement to benefit this type of student population. This slide discusses the supporting theory of teacher-centered approaches compared to student-centered approaches. We've discussed what teacher-centered and traditional learning is, and then the benefits of a student-centered approach under the adult learning theory includes the fact that the teacher becomes more of a facilitator and a partner in the learning with the student. There's trust involved, there's cooperation, and it's a collaborative learning environment. Leadership strategies needed to be implemented in order to make this type of a project come alive. Personally, I use tactics of a situational leader. Situational leadership has been defined as based on a relationship between the leader's supportive and directive behavior and between the follower's level of development. Meaning that there's flexibility with change in the environment and with the needs of the situation that are presented. Initially, this project was meant to be a case study done in the classroom to promote interprofessional collaboration and communication. However, with insight from the course mentor, along with the other interprofessional members, it was noted that there's not enough time in the classroom for such case study. Therefore, the case study was moved to the web. Situational leadership styles often involve contingencies in order to ensure that goals of the project become a success, as noted with our contingency of moving to the web. Situational leaders also take on several other leadership styles in order to make the goals of one particular situation or project successful. In this case, the other type of leadership that was taken on was transformational. There was a vision seen for this project, and it came alive through the efforts of the interprofessional team and myself. Transformational leaders convey a clear and concise vision and empower others to achieve their full potential in obtaining that vision. Not only were the leaders of the project had a vision, but the project provided students with a vision to provide interprofessional care and communication to their patients. In order for a web-based project to come alive, we must consider systems. Systems such as high-speed internet access and having Microsoft systems such as Word available were essential for project success. The discussion questions were to be filled out on Microsoft Word and submitted through Angel. Learning management systems in nursing education can assist in formatting course content to promote enhancement in nursing collaboration through a hybrid structure. In this case, Angel was our learning management system to organize the coursework, and this is also the system where the web scenario was posted for student completion. Achievement of project outcomes have been achieved through validation by the project mentor and feedback received from student evaluations after completion of the learning activity. Project outcomes. The first project outcome was project completion was achieved through acknowledgement of interprofessional collaboration with the project mentor and director of the program to synergize recommendations with the nursing education that will logistically work with the nursing program's current curriculum structure. This was supported by what is outlined by the AACN Essentials for Baccalaureate Education. And the efforts of the Capstone project aligned with number 4, that includes the utilization of health technology, and essential number 6, which notes the inclusion of interprofessional communication and collaboration in the Capstone project. Outcomes number 2, project mentor will confirm that the web-based case scenario adequately meets the course objectives. And outcome number 3, project mentor will approve the web-based case scenario learning activity format and content prior to it being assigned to the student's workload via Angel during the week of October 7th. Outcomes 2 and 3 are supported by the passing of the Affordable Care Act. Nursing education must redesign curricula and delivery methods to stay astute to these changes for pre-licensure and post-licensure nurses, with efficient efforts to educate on concepts of interprofessional communication and collaboration. Outcomes 2 and 3 were effectively met with the project mentor to organize implementation of such learning activity. The final outcome was project mentor will acknowledge my professional values, leadership characteristics, and commitment to the project. The fourth outcome was obtained through validation from the project mentor, along with the fact that she has verbalized willingness and motivation to continue to use this project for future semesters. Achievement of project outcomes. The project outcomes themselves were achieved and validated through the completion of the student evaluation forms. The first 2 questions on the feedback form stated, after completion of this learning activity, do you feel as though you can implement concepts regarding interprofessional collaboration during your care of a patient? Question number 2 stated, after completion of this learning activity, do you feel as though you could implement skills and tactics to achieve effective communication during your care of a patient? Both questions received 100% student feedback stating that they felt that they could accomplish both outcomes. Other project outcomes include that 72% of students stated that they would prefer more learning activities than a web-based, self-paced template. And the final outcome from the evaluation forms said that 56% of participants stated that although the instructions that they thought the instructions to the learning activity were clear and easy to follow, meaning that 44% of the students felt that there were some unclear parts of the instructions of the assignment. Efforts have already been made to improve clarity of the instructions through the use of an objective third party to give feedback regarding learning activity instructions. Both the mentor and myself felt that the instructions were very clear before the assignment was posted. But once the feedback forms were analyzed, we noticed that there is room for improvement. This project has proved significant change to the organization in a positive way. It's a cost-effective way to meet student learning outcomes for particular courses. It's efficient in delivering the same content the same way through the same modality every time. Often when instructors or teachers are providing course content, it can be interpreted and heard in many different ways from students. Learning through technology offers consistency. Self-directedness provides higher levels of understanding and reflective knowledge regarding course outcomes. And we have achieved successful accomplishment of all of our project goals and outcomes. As future master's prepared nurses, my graduate program has provided me the tools to teach with technology. Before this program, I did not even know such programs existed to deliver such lessons. The awareness to stay astute to the recommendations of accrediting bodies such as the Institute of Medicine, the American Association of Critical Nurses, and the World Health Organization. Their standards are constantly changing, and as advanced practice nurses, we must constantly stay astute to what they are saying is the best evidence-based practice for patient-centered care. And the skills to implement these recommendations in savvy ways to meet educational needs of current and practicing nurses. Once again, as an advanced practice nurse, we must stay astute to the best ways to deliver education to current and future practicing nurses. As a leader of this project, I identified a need for change. I proposed that change to key stakeholders, and I planned and implemented the efforts for the vision of change to come alive as a situational leader. I successfully implemented that change within an interprofessional team according to the project's objectives. The spirit of my capstone came from my commitment to lifelong learning and quality of nursing delivery in an evidence-based, patient-centered way. I started by noticing that there was very little change within the ADA program that I graduated from, and understanding that multiple benefits of the implementation of technology-based lessons within the adult learning theory. After my first mentor meeting, she discussed the rollout of the program's first hybrid course. According to the IOM, concepts of interprofessional collaboration and communications are often missed at the undergraduate level. Therefore, the spirit of this capstone took off. Ultimate project success is that the project mentor verbalized intentions of continuing to use this learning activity. I cannot think of a better way or more positive effect of such efforts. I thank you for your time and your interest in my project. I just would like to follow up with my reference slides. And if you have any further questions, you can reach me at my email, cassmore0402@gmail.com.